Hello everybody, my name's Anji. I'm the subject lead for care in the Hastings University Centre, and I have responsibility for level 4, 5 and 6 courses in childcare, health and social care and teaching assistants. I've had a lot of inquiries recently from people that normally I would have had a one-to-one or face-to-face conversation with, but the current situation has prevented that. So I thought I'd take the opportunity to answer some of your questions here online, and hopefully that will help you make some decisions for September. So I've drafted in a questionnaire. Let's start our session.
First question, if I have a level 3 qualification in care, what can I do next?
Okay, we have a level 4, 5 HND in Health and Social Care Management, and we also have a foundation degree in Early Years Care and Education. Now, you could opt into either of those if you wanted to, but it makes more sense to stick with your subject area. So if you've got a level 3 Health and Social Care qualification, the HND is for you. If you've got a level 3 childcare qualification, then the foundation degree is the right choice for you at that point.
How will I choose which course to do?
Well, that really comes down to what you want to do long term. So if you're thinking of working in a care setting, an adult care setting, then really you need to be looking at the HND. It covers a variety of topics leading towards management. The expectation is that you would have already been either working or had some work experience in a care setting, but it builds on the knowledge that you would have started at level 3. If you're thinking about going into teaching or childcare or working within the care sector, but predominantly aimed at children and young people, then you need to be thinking about the foundation degree, because that focuses much more on the planning, the observations, managing a team, and looking at aspects of early years care that you would have started to explore at level 3, but this really does take you up to the management level.
How will the classes be delivered?
Well, we have a mixture of delivery methods. You will get pre-course, pre-unit or module material, which will start you off on a new subject. All of the materials are published on our virtual system, which is called Moodle, and you will also have class time and workshops. The HND is delivered over 2 days a week. The FDA is delivered over 2 evenings and Saturdays. So there's a slightly different approach to the work here. Saturdays are for workshops, which usually allows you to get to really get to grips with the course content and to share the ideas and explore different options with your peers.
What will we do there?
Well, our choices are limitless. Sometimes it'll be a talk session, so you may have a more formal style of lecture. Other times it will be a workshop session where you might be creating or making something with the rest of the group. Sometimes it will be a really solid support session where you're working on an assignment or an assessment. And other times it will be much more learning for yourself, so research opportunities, time to explore options, time to compare and contrast with other people in the class, because a lot of the work that we do really allows you to explore what other people are doing and take the best possible practice from every setting to improve your own.
And who else is in the group, and how big is the group?
Well, the group is always very, very, very varied. We have some students who progress directly on from level 3. We have other students who've taken a couple of years out to get themselves established in the workplace and are returning to us to do their 4, 5 or 6. And we have other people who've not really had any formal education for quite a while, but need to formalise their qualifications in order to take on a higher role or a different role. And so sometimes our classes span from 17 to 58, and with a huge range of experience and backgrounds within that. So we've had people who've been social workers coming back to do a childcare qualification. We've had people who work for St John's Ambulance, for the hospital, for care homes and hospices, for nurseries, for schools. So a huge range of people join our classes, but all with really, really interesting background experience and loads of knowledge to share.
And who are the teachers?
We have a small teaching team, deliberately so. That means we get to know you really, really well. And all of them have a very, very comprehensive knowledge of their subject based on extensive work within that area. So we have people who've been a nurse, looked at psychiatry, worked within the care sector, worked within childcare, been a very experienced science teacher for a number of years. So they've all got a lot of experience and a lot of knowledge, which means that you have the opportunity to draw on that expertise in confidence that they know what they're doing.
How do we get assessed on these courses?
Well, assessment there's a lot of different styles of assessment that we use. For the HND courses, it tends to be more formal essay style assessments. Having said that, we are still expecting you to participate in group activities and presentations, but it's slightly more academic writing. For the FDA, the foundation degree, you are expected to create displays, participate in discussions. You will still have essays, but they're not as frequent as for the HND courses. For level 6, for both of the options at level 6, you'll be doing a lot of individual research projects and making changes in your setting, which you then report back to us. So the style changes as you go through level 4, 5 and 6 to some degree. All of them have a set deadline, and because the FDA and the level 6s are validated through the University of Brighton, we follow the university rules, which is submission of work by a date, by a time. For the HND, we have set deadlines which you have to upload your work onto Moodle.
And do we also get assessed in the workplace?
You don't get formally assessed in the workplace, but you will have visits from your class teachers. For the foundation degree, because a lot of the work is about you making a change and making recommendations for change, your tutor will come and visit you to discuss through your options and to make some suggestions, because sometimes a fresh pair of eyes sees things that you have got used to. For the HND, you will have visits to observe you in the setting, carrying out various tasks that you need to demonstrate to satisfy some of the criteria for your course. So things like talking to your service users, creating records and reporting back on it, having conversations with staff about medication. Depending on what unit we're looking at the time, your tutor will come out and visit you, do an observation and use that as evidence that you're competent.
And how do we get graded?
Okay, for HND and for foundation degree, it's pass, merit, distinction. And there are very clear guidelines as to which criteria you have to achieve to be able to achieve those grades. For level 6, it's the same as university courses, so it would be first, 2-1, 2-2 and a third, depending on how many points you score.
Does level 6 give me a degree or an equivalent degree?
Right, level 6 is the equivalent to a full degree. So you are going to earn either a BA, a Bachelor of Arts, or a BSc, a Bachelor of Science. So it is exactly the same as any degree, and it's validated by the University of Brighton, so you know that they wouldn't give you a degree if it wasn't a degree.
What if I have to go to work when I'm supposed to be in class?
This does happen. I know that particularly with our healthcare students, sometimes their shift changes, or for the foundation degree, their children, their rotas change and they need to be included in the ratios. It's not ideal, but all of our work goes onto our VLE, so you can access it from home at any time. The awarding bodies, which is Pearson BTEC for the HND, like you to have an 85 to 90% attendance. So they would question if your attendance dropped very dramatically lower than that. The one thing I will say is, if at all possible, it is really, really important that you come, because although you can access all the materials online, it's not the same as talking it through with your peers. It's not the same as having your questions answered in class. And you just really get to grips with the whole content if you're physically in the classroom.
And is there other support that's available?
There is. We have a fantastic library with really, really supportive library staff who are willing to help you with your research, help you with your writing, and they will look at your work to make sure you're on the right track. We also have an HE mentor whose job is to support the students both pastorally and academically. So if you have a problem, you can arrange to meet with her and she'll take you through possible options and possible solutions to problems. We have a great ALS team, and they will take you through from dyslexia testing through to providing resources and strategies to manage the situation. So there's a lot of people around. Bear in mind the class sizes are quite small, so you've always got access to your teacher.
How do I apply for these courses?
For all of our courses, you can apply through UCAS, or you can apply directly to the college. You can apply online, and the form is found on the ESCG College website, and you can complete the form and send it in. You'll get confirmation that your application's been received, and at the moment we're doing telephone interviews, so you'd be given asked when is a good time to have an interview, and one of the lecturers will contact you to interview you over the phone.
And when do the courses start?
Courses start at the end of September, and if you have a Saturday class, it usually starts before term starts. So classes, the formal academic teaching classes, start the first week in October, but you may have a Saturday workshop just before that if you're on the FDA or the level 6 courses.
How much do the courses cost?
There's a slight difference in costs. An HND is 6,900, an FDA is 7,000. The difference there is because it's validated by the University of Brighton. And a level 6 course is 7,500. But all of the fees are, it's possible to claim payment for all of the fees through Student Finance England, provided you haven't had another degree level course. You're entitled to 4 years of higher level education fee funding. So even if you've done 1 year and dropped out, it might be possible still to claim the full course back. There's also bursaries and grants you can apply for. And if you do need any help or support, we have an admissions lady called Jordan who will help you through all the paperwork and answer any questions to do with funding.
And are there any entry requirements?
You need to have a qualification at a level lower than you're applying for. So if you're applying for level 4, ideally you need to have a level 3 because the course builds on knowledge that you've acquired at level 3. You also need to be working in a care setting. So either in a nursery or a school if you're applying for the FDA or the level 6 BA, or in a care home, care setting, hospice with adults if you're applying for the HND or the BSc. You need to be working there for a minimum of 12 hours a week, and that's because your course hours are calculated on you working for a number of hours. It makes it a full-time course. You also need to have a clear DBS, which we need to be able to see before you start the course.
And if we don't have a DBS, can you help us with that?
Absolutely. If you haven't got one, and I'd be really surprised if you haven't, we can actually help you. Usually your setting insists on you having a clear DBS before you start work.
And final question, what do you think your current students would say about their course?
I think they'd say it's challenging, but it should be. It's exciting and fun, which it is. We do have great laughs and giggles. It's helpful because they've all used their qualification or their knowledge from class to make big changes in what's going on in their work setting. But overall, I think what they would say, if I was to ask any of them, is how much they actually have grown as a person through completing the courses. They have improved their confidence. They've not just expanded their knowledge, but they've worked out how to use it. They've grown into a position that they didn't think they would ever be able to grow into.
That's wonderful. Is there anything else that you would like these good people to know about the college or you, the courses, your students?
I think if anybody's interested, they need to contact the college. At the moment, we're doing virtual tours, so hopefully, once the world returns to normal, we'll be back in our classrooms and you can come and see us for real. But we have our own designated floor. It's very grown up, but extremely good fun. Come and try us.
You have good coffee, don't you?
Oh, excellent coffee. And we do like cake.
And the final question is, when did you last change the batteries on the clock above your head?
The clock above my head says 5 o'clock because that's when most of our classes for evenings, level 5, level 4 and 5 for FDA and level 6s start. So we do have evening classes. So the clock says 5 o'clock because I'm ready to start work. Are you?